Hello, everybody. Thank you so much for joining me in this discussion board. I am presenting to you the lesson plan overview, essentially, of what I have created for my QSEN competency. In this case, the competency I chose is evidence-based practice. It focuses on COVID-19, congestive heart failure, and I'm trying to tie it all together for the staff in cardiology where I currently work. We have a large CHF population that we deal with, and the pandemic has made it quite interesting in coming up with the right answers to many of the questions we get from our patients. So the class mix would consist of 12 staff nurses, 2 RN case managers. The 2 RN case managers are fairly experienced with this patient population. They tend to deal the most with them. The other 12 staff nurses largely consist of nurses who work in the diagnostic areas of the department, and their exposure to assessing these patients and having more in-depth conversations are quite limited. So it would be very good for them to have the type of exposure where they will feel more comfortable assessing these patients and also answering their questions related to COVID-19 and the vaccination process, etc., with their history of heart failure. So the goal is for the staff to verbalize the importance and the role of evidence-based practice in the care of CHF patients and demonstrate appropriate physical assessment of the patient with suspected fluid volume overload. Staff nurses will then demonstrate how to retrieve evidence-based practice information from UpToDate and how to appropriately chart their assessments and the electronic health record. The nurses I work with all have varying experiences in terms of nursing and patient care. Their knowledge levels tend to be quite different. We have nurses who have worked many years in the emergency room. A good amount of these nurses have also worked on step-down units, so they're more familiar with CHF patients and their long-term treatment. And we have one ICU nurse that also works with us now and who tends to have a little more of the in-depth knowledge as well. To start off the class, of course, I would like to assess their current state of knowledge using an electronic survey and kind of gauge their knowledge of the pathophysiology involving heart failure. Again, because of the varying backgrounds of the nurses, it will be important to figure out in general where their knowledge base lies, and from what standpoint I would have to start to teach them a little more in-depth pathophysiology. And I would utilize YouTube video links to show an illustrated version of the pathophysiology. The animations tend to be more interesting, and it also prevents some of the fatigue that the students typically experience by listening to the same presenter over and over again, and that usually helps them remember a lot of the information better. The next topic, of course, would also be CHF pharmacology, what evidence-based practice shows us in terms of the best diuretics to use, the supplements that are needed, the beta blockers, the ACE inhibitors. This patient population, of course, has quite a larger repertoire of medications that they have to deal with. There are many frequent questions about these medications, so therefore it would be very important for the staff nurses in our department to have a good foundation knowledge of these medications when they speak with the patients over the phone. We also administer IV Lasix and IV Bumex in clinic. The nurses are responsible for giving the medications, of course, and providing education with the administration of these medications. The purpose of doing this in clinic, of course, is to prevent the patient, hopefully, from having to go to the hospital and being admitted. And again, I would use a YouTube video on pharmacology with animation to present the different classes of medication that are used for these patients. CHF and evidence-based practice would talk about mRNA vaccines, dispelling a lot of the myths that are out in the community about the vaccines, because a lot of our patients are very interested in getting the vaccine. At this point in the pandemic, a lot of them have received the vaccine already, but many questions still arise as we're learning more about how we're all reacting to these vaccines and what we're learning. So there's a lot of questions. There are a lot of questions about COVID-19, its impact on heart failure patients, especially with the inflammation that the body goes through with COVID-19, of course. So it will be very important for the staff nurses to know how to retrieve scientific knowledge, especially from websites like Up to Date, and how to educate themselves, which in turn will educate the patients, of course, in the long run. And for the final part of the class, I would plan on using simulation to allow the nurses to basically practice their assessment skills, focusing in on asking the right questions, determining when a patient may need a higher level of care, such as in places like the ER, if their symptoms are not manageable in the clinic. And I could also use this as a summative evaluation tool to gauge their understanding of the class material. And in the end, documenting the assessment findings in the cardiology specific flow sheet will be necessary as well. We're trying to find a standardized way of doing this rather than everyone developing their own way of documenting, which sometimes creates a lot of forth and back between the providers because of the lack of information in the computer system. And thank you so much for joining me this evening. And if you have any questions, please feel free to ask away. Thank you.